Hello, and thanks for stopping by for this Medicare Advantage Clarity presentation for 2021. Clear answers to your Medicare questions. This is me. I'm Tom Basie. I provided my phone number, and really the best way to reach me is via email. I'm here to help. So hopefully I'm going to share a lot of information you can use here. But if somehow you have additional questions, please do not hesitate to reach out to me. I'd like to chat further with you about it. Aparte, yo hablo español. Yo puedo atender a la gente en su idioma si sienten más a gusto hablando en español. So here's the agenda of what I'm going to discuss. Understanding some Medicare choices that are available to folks. Talk a little bit about eligibility and enrollment. I'm going to talk about the advantages of Medicare Advantage plans. I've got several slides on prescription drug coverage. That's a point of confusion for people, for many folks, so I hope to clear that up for you. I've got some specific 2021 Medicare Advantage plan information. I'm going to lay 4 plans out side by side and let you look at some of the differences between them. Talk about how agents such as myself can provide additional assistance to you. Talk about some additional resources that are available to you. And then finally, I will remark about a little bit about United Healthcare, where you might consider them as your partner in your Medicare journey. So here's the thing, understanding Medicare choices. Number 1, enroll in Original Medicare. Well, Original Medicare, this is a red, white, and blue card. It comes from the U.S. federal government. It's got somebody's name on it. Their Medicare ID, which is numbers and letters, and then it has Part A and Part B effectivity dates when they start. Part A is hospitalization. Typically, that's paid for as you work and they take the FICA tax out of your paycheck. Part B is typically not yet paid for, and for 2021, it's $148.50 per month for many people. So it's relatively cost-effective to have some government-provided health insurance. Now, there is a deductible for around $1,400 for Part A, the hospitalization, and there's a deductible of about $200, $203 for Part B, which is outpatient hospital, not in the hospital things like doctor's visits, testing, anything that's done not in the hospital. That's Medicare at a high level. Now, having said that, you have a couple options you can do in addition to Medicare. You can do option 1, you can get a Medicare supplement insurance policy from a carrier, not from the government, and then you can add a drug plan. Medicare supplement doesn't have drug plan, so you can get these two things, put them together, and complement or supplement your Medicare coverage, or you can get an Advantage plan. An Advantage plan does have Part D. Think of D as in drugs. It has drug coverage included in it. Sometimes called Part C the Advantage plan. So that's the thing. Nothing else, take away Part D is drug coverage, and understand that if you do option 1 with Medicare supplement, you need to add the drug plan to have drug coverage, or if you get an Advantage plan, sometimes called Part C, that it has drug plan coverage included. It has some other additional benefits not provided by Medicare that I'll share more with you. Option 1 versus option 2. Having said that, well, to get Medicare, you got to be at least 65 years old, or there are some extenuating circumstances with disability. Somebody can qualify. There's other ways you can get in there, but as a general, it's for people who are 65. There's some exceptions for people under 65 years old. Also, it's for U.S. citizens. Well, actually, if you're a legal resident and live in the U.S. and have lived consecutively 5 years, there's an alternative. You can get Medicare as well. So there's two major criteria. It's typically 65, typically U.S. citizen, but not exclusively that. Having said that, there's an initial enrollment period around the month of your birthday. It's the month of your birthday. You can certainly enroll. You can also enroll 3 months after and 3 months before, and that's your initial enrollment period. You can get Part A and or Part B or both at that time. You can also join an Advantage plan and or a drug plan and a Medicare supplement at that time. So to me, that's the obvious first time to take it. I'm a proponent of getting it early, so you can do it 3 months before the birth month of when you turn 65. I'll say this more than once, although you're not required to enroll in Part D, remember that's drug or prescription drug coverage, there's a penalty of 1% of the monthly average premium for each month you delay enrollment. So I recommend going ahead and enrolling one of those, even if you don't take medication, to avoid that penalty. Okay. Having said that, there's a couple other annual enrollment periods. Annual enrollment period is October 15th to December 7th. You can add, drop, or switch your Medicare coverage and Advantage plan coverage at that time. The fall of the year, at those times you can do it. Also, right after that, if you're already in a Medicare Advantage plan, you can enroll from that current plan or go back to change to a different Medicare plan or go back to Medicare. There's a one time only, the first quarter of the year after that. So in addition to whenever you turn that initial enrollment period of 7 months, you've got a couple other windows every year where there's some changes you can make. In addition to that, there are special enrollment periods. If any one of these events occur, well, then there's a special enrollment period where you can also do it during the year. So one, if you retire during the year and you lose employer coverage, special enrollment period at that time. If you move out of the plan service area and you're on a Medicare Advantage plan, which our network/location based. Well, if you move out, well, then there's a special enrollment period. You can make a change then. If you qualify for extra help is financial assistance from the federal government. If you hit financial hard times and you qualify for that, well, then there's a special enrollment period and you can make changes to your Medicare Advantage plan at that time. If you get diagnosis from certain chronic health conditions, maybe diabetes, maybe some heart disease or some examples of that. So any of those four things occur above and beyond all the other times we talked about, there's a special enrollment period so you can make a change in it. So my point is, throughout the year, there are potentially periodic times where someone could make a change to an Advantage plan. Now, having said this, it says the Advantage might more aptly call this compelling statistics. 24 million people are enrolled in a Medicare Advantage plan back in 2020. Of those, over 9 out of 10 of them are satisfied with that plan. And the reason is because they typically spend on average 25 less than Medicare alone. So there's just some big compelling numbers why you ought to consider perhaps an Advantage plan. Now, having said that, this is a nice side-by-side comparison. Here's original Medicare. Here's a Medicare Advantage plan. Both have coverage for hospital stays. That's Part A. Both have coverage from some medical care like doctor visits and preventative services like flu shots. That's Part B. So original Medicare has that, as does the Advantage plan. They both have that. What Medicare does not have, notice it says no coverage, but an Advantage plan does have prescription drug coverage. Potentially Medicare Advantage plans have those. Some vision coverage perhaps. Routine hearing exam and hearing aid coverage. Maybe even dental didn't show up here. Notice it says asterisk, varies plan by plan. But my point is Medicare has none of that, and a Medicare Advantage plan potentially has those. Limits your out-of-pocket cost. There is no out-of-pocket maximum original Medicare. Unfortunately, if you have to go to the doctor every month and your bills add up because you pay for copays, that kind of stuff, it can just keep going. If you get an Advantage plan, at least there will be some plan established. I don't know if it's $3,000, $4,000, varies plan to plan, but whatever it is, you will not exceed that amount annually. The plan will cover additional costs once you hit that amount. Okay, so I'm going to go through top 10 things, not necessarily in order, but these are some good points that I want to make about Advantage plans. You must continue to pay your Part B premium. As I remarked in 2021, that's around $148 for most people. Even if you sign up for an Advantage plan that costs $0 premium per month, and there are plans that way, that is $0 premium, but that's the thing, you have to keep paying your Medicare. Medicare Advantage has you covered. To me, that's another way of saying it covers the stuff that Medicare does and more. Joining a Medicare Advantage may affect your current coverage. Well, we remarked about the special instance where you, for example, if you retire, so you want to coordinate benefits and make certain that you, when you retire, your coverage doesn't end until after a Medicare plan cuts into place, for example. Or if you're a veteran, you can actually get some Advantage plans that work and you can keep your VA benefits, but then your Advantage plan would come into effect. So it's just important to be aware of what your current insurance coverage is prior to getting an Advantage plan and understand how they work. It's best to use network providers. We almost never use the word best in Medicare land, but we do here because some plans allow you to go out of network. And if you do, that's fine if the plan allows you to, but it's going to cost you more. So it's better and or best to do it in network providers. You may qualify for financial assistance. Even at the state level, Medicaid, extra help I've already mentioned once is financial assistance from the federal government. The state administers some financial aid, often called Medicaid, and you can get assistance there. And there's plans that specifically for people who are both on Medicaid and Medicare. Okay, 5 more for you here. If you enroll in Part D late, you may pay a penalty. I already marked on that once. So my endorsement is go ahead and enroll in some kind of coverage, even if you're not taking medication, to avoid the penalty. A Medicare supplement insurance plan, sometimes also called a Medigap policy, is not a Medicare Advantage plan. That's that option 1 versus option 2 coverage. The Medicare and supplement insurance plan doesn't have the drug plan, so you need to add your drug plan as well. It's not an Advantage plan. Keep your member ID card handy. Actually, if you have an Advantage plan, you can leave your Medicare red, white, and blue card at home, and you can take, and when you go to the doctor, you carry your Medicare Advantage plan. If your plan has drug coverage or vision care or dental, when you go to any of those care providers or the pharmacy, you take your plan card. You don't need to carry your Medicare card around. Medicare Advantage offers the same protections as original Medicare. That was the first 3 check boxes on the side by side. It's the hospital stuff and then the preventative stuff and doctor's visits. It has that. You have a built-in financial safety net. I'll say that again. So an Advantage plan has an out-of-pocket max. Could be $3,000, could be $4,000, could be $5,000, whatever it is. It's at least established, and at least you know your cost of care is not going to exceed that for the year. The plan will pay for costs that exceed that amount, whatever it's set. Medicare alone doesn't have that. Okay, I'm going to spend a few slides talking about prescription drug coverage because it's a point of confusion. Perhaps one of the most frequent questions I get about drug coverage is, why is it I have the same medication, go to the same pharmacy, and throughout the year what I pay changes? This chart does a nice job of explaining why that happens. So there's 4 stages of payment: annual deductible stage, initial coverage stage, the coverage gap, also known as the donut hole, and the catastrophic coverage stage. Depending on which stage you're in, you're going to pay a different amount. If you're in the deductible stage, not unlike any other insurance, that the plan doesn't pay anything during the deductible stage, so you pay that. So if there's a $300 deductible on your drug plan or your Advantage plan, and your drugs cost $100 retail, well, then the first 3 months you're going to pay 100, 100, 100 because you're still in the deductible stage. Not until after you've paid those and you get out of the deductible stage does your plan then pay for some or all of the medications. Now, once you're in the initial coverage stage, there's a copay, and then the plan pays the balance of it. You pay the copay, the plan pays the balance. So I'm going to make up a new scenario, and I'm going to cleverly use the numbers 1,000 and 100. Let's say your retail cost of either an expensive drug or set of drugs is $1,000 monthly, and let's say your plan, your copay on those turns out to be only $100. Well, if that's the case, then as long as you're in that initial coverage stage, then for each month, your total cost is $1,000, but you pay the copay, which is $100. Now you're going to stay in that phase until you exceed 4130 in 2021. So therefore, not until month 5. So you'll stay in initial coverage for the first 4 months. So you'll pay $100, $100, $100 each month of that $1,000 cost of drugs. Now, once you've exceeded 4130, so in months 5, 6, 7, as you go along, now instead of paying that copay of $100, you got to pay 25% of the cost. So if it's a $1,000 bill, now you're paying $250 for that same bill, just because you're out of initial coverage in the coverage gap. Now you're going to stay in that for month 6, 7. Once you're in month 7, then after you've paid over $6,500 for your cost of medication, then you'll drop into catastrophic stage. So at that point, then you'll either pay a low copay, $3, $9.20 for some drugs, or 5%, whichever's greater. I'm going to go with whichever's greater. 5% of 1,000 is 50. And you'll do that through the rest of the year. So in that example I made up, paid $100 for a while, then you paid $250 a while, and then you paid $50 a while, depending on where you were in the coverage stages, and that was defined by kind of the total cost of coverage. Once you were in the initial coverage state until it exceeded 4130, then you're in the donut hole until it exceeded the total cost 6550, and then it dropped to catastrophic. So that's how that works. I think this chart does a pretty nice job of illustrating that. Having said that, remember that was total drug cost. That's what you pay plus what your plan's paid. It's not just your copay, it's the total amount. It doesn't count the premium. So that's what's used to determine where you are in the stages. Your out-of-pocket costs also don't include the premium. That's any copays you pay and a deductible if your plan has it. So those are just some good definitions to understand. Here's some more here. Pharmacy network, for United Healthcare, they have over 65,000 pharmacies. That means it's likely there's a pharmacy near you. Not all pharmacies are in their network, but it's likely there's one near you. You can save on prescriptions, if you'll recall, if they are in network. It'll cost less than if you go out of network. You can also save with mail service pharmacy. You can save some time too as well. So there are 2 different ways you can save: either go into in-network pharmacies and/or using mail order. The drug list is called a formulary. It doesn't have every drug in the world, but it's a pretty nice list of drugs, pretty thorough list of drugs that shows what the plan does cover. And when they're on that list, they're tiered. They're always in tier 1, 2, 3, 4, or 5. One of those, they're in there. Tier 1 is a preferred generic drug. Tier 2 is a generic drug. Tier 3 is a brand name drug. Tier 4 is a non-preferred drug, and Tier 5 is a specialty drug. I suspect you might be able to guess that the cost goes up as the number of the tier goes up. And every drug on the list is listed there, and so it's used to determine what the copays are, for example. Having said that, a little bit more, step therapy is when you try to use a low-cost drug to treat a condition, and then if that doesn't work, then go to a higher-cost drug. Quantity limits are whenever only a certain amount of drug for a copay is allowed, or over a certain number of days or a certain amount. So there are step therapy, there's quantity limits, and then prior authorization. Sometimes before a plan will cover it, it needs information from the doctor to make sure it's being used correctly or for the right condition. So there's just kind of some limitations that sometimes come up. Having said that, you can get exceptions. You can, if you need a drug that's not on the formulary, you can request a formulary exception. If one of the limits that we previously marked about, for example, the number of days, something that needs to be exceeded, you can ask for a utilization exception. Now, If the doctor submits an exception request, generally the plan will make a decision within 72 hours. It can be expedited or fast-tracked, the decision that is, if your doctor believes your health requires it. So not every single drug in the world is on the formulary, but you can request an exception, and it's more going to be quicker to have a doctor request it for you. Okay. Having said that, now what I'm going to do is I'm going to show you 4 plans laid out side by side. All 4 of these plans are from United Healthcare, and although they are for the Dallas-Fort Worth area in Texas, maybe it's likely there's one or more of these plans very similar to this near you. They may not have the exact same numbers, but they're going to be nice representation. So I would encourage you as I step through this to take a look at all 4 of these plans. I'll point out the differences. Think about which one appeals most to you. So this is going to be a nice illustration of how plans differ at Advantage plans, even within the same carrier. So here we go. Plan 1 and Plan 2. This one's called Advantage Plan, a little confusingly, and Choice. These are some legacy plans. They've been around in the market for many years. These are newer plans. So legacy versus new. Plan 1 versus Plan 2. Actually, I'll talk a little bit more about that. They've been around for a while. All 3 of these plans are HMO plans. That is, they only have an in-network care option. If you go out of network to a care provider, these plans won't pay any benefit towards that. You're going to have to pay that out of pocket. The Choice Plan is a PPO, Preferred Provider Organization. That is, you can either go in network or out of network. If you go out of network, you can, and the plan will still pay, but it'll just cost you more. The care will cost more than if you're in network. So, of these plans, all 3 of the 4 have a $0 premium per month. Only Plan 2 has a paid premium. And what happens is Plan 2 is kind of like it was kind of like Plan 1, but you pay some. And what happens is you will drive up the benefits and drive down the copays if you do that. So it's kind of that's the way it is. So if you want lower copays and higher benefits, you can pay more per month. Otherwise, you can get a $0 plan. 3 of these plans are $0. Annual medical deductible is $0 on all 4 of these plans. A primary care visit on all 4 of these plans is $0 copay. Specialist visit varies a little bit. The Plan 2, where you're paying the premium, has the lowest copay of $20. The Choice Plan, where you have a flexibility out of pocket, has the highest copay at $35. The Plan 2, or rather, this Advantage Plan actually has a $25. So that thing, they don't vary a lot, but it's kind of, there's a trend that you're going to see is, again, lowest copays for the paid plan, and then the plan that has the most choice actually has the highest cost or copays. Preventative services on all 4 of these plans are $0 copay. Specialist referral required. Yes, 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 no. That is, this Choice Plan, not only is it a PPO that you can go out of coverage, you can go out of network for care, you also don't have to get a referral for a specialist visit. So it is more flexibility. It's called Choice, but it's going to cost you a little bit more annually to have that, for that flexibility. Here's one of the biggest examples of that: inpatient hospital care. Plan 2, where you're paying the premium, it's just a $150 copay per admit. So it's the one that costs the least a hospital stay does. Plan 1 costs $275 a day for days 1 through 5, and then it drops to $0 copay for the duration of your stay. These 2 newer plans, they actually cost $325 a day as a copay, and they actually go an additional day. They go to day 6 before they drop to $0. So this one has the lowest cost in a hospital stay, and actually this flexible one, and in this instance, this one actually have a highest cost of hospital stay. Skilled nursing facility. Plan 2, where you have the paid premium. Actually, all 4 of these plans have a $0 copay for days 1 through 20. They all have the same daily copay of $184, but the number of days that you have to pay that varies. The one with the lowest number of days where you have to pay that is Plan 2, all the way through day 38. 21 to 38, you pay $184 copay, then it drops to 0. Plan 1 and this Advantage Plan, which I kind of remarked as kind of like a reformulation or a new version of Plan 1, these go to day 42, so they go a few more days at that $184 copay before it drops to 0. And then the Choice Plan goes all the way out to day 57. So if you have to go way beyond 20 days, the flexible Choice Plan, if you will, is going to cost you significantly more. Outpatient surgery, it's actually either a $0 copay or a number copay, and these correspond to the daily rates of the hospital stay. $150 copays for Plan 2. Plan 1 has $275, and these 2 newer plans have a $325 max copay for outpatient surgery. Still not bad. That's not too expensive. You're too expensive about care so far as hospital stay or skilled nursing facility, and they vary plan to plan. But even so, pretty good. It's not too bad, really. Diabetes monitoring supply and home health care are $0 copays on all 4 of these plans. So I got 3 more slides like this to kind of just show you how the plans are different. I hope you're already thinking about which one of these would appeal to you so far. Let's see if your opinion changes. You look at a couple more slides here. Diagnostic radiology, it can have a max of $125 copay on the legacy plans. It can have a max of $150 copay on the newer plans. Diagnostic, similarly, $20 copay for the legacy plans, $25 copay for the new plans. Not a big deal yet. Lab services are $0 for all 4 plans. Outpatient x-rays are $0 for the 3 HMO plans. For the choice plans, actually still $15 copay. Again, you can see the theme here. It costs you the flexibility, costs you a little bit more. Ambulance is the same, be it ground or air, for all 4 of these plans, $250. Emergency care, same for all 4 of these plans. It's a $90 copay, and that gets waived if you are admitted. Urgent care, actually on the urgent care, be it contracted or non-contracted, that's a $40 copay for these 3 plans. Actually, the plan that's kind of designed to work out of network is actually only $30 if you go in network. And then here's the big number here. This is the total out-of-pocket maximum, which is great to have because there is no out-of-pocket maximum on Medicare. Plan 2, where you're paying your monthly premium, it only has a $3,200 out-of-pocket max. Plan 1 and the Advantage plan, kind of like the new Plan 1, they have an out-of-pocket max of $3,900. The Choice plan, which is the PPO, actually gets up to $6,700 for out-of-pocket. So I think you're understanding the trend here. We're going to look at a few more slides to understand further. I'm not going to read through this drug plan, but what I would show you is Plan 2, where you're paying the premium, actually has a $0 copay for Tier 1. Plan 1 has a $2 copay, and the Choice plan has a $3 copay. When you go all the way down here to the deductible, actually all 3 of these plans have a $0 deductible for all tiers. The Choice plan has a $0 deductible only for Tiers 1 and 2. For Tiers 3, 4, and 5, the more expensive drugs, is actually $345 copay. Now, here's some benefits above and beyond Medicare. 2 of these plans have $500 of dental coverage. The plan where you pay monthly, and then the new version of Plan 1 actually gives you $500 more. That is $1,000 of dental coverage. So there's more dental coverage on a couple of these plans, less on the others. Vision care, it's a $0 copay for an eye exam every 2 years on all 4 of these plans, and it's a $100 allowance towards eyewear, except for the plan where you're paying an additional premium. You actually get $200 allowance for the eyewear. So I think you're seeing a trend here. No, you get more when you pay more. What a surprise. Routine hearing coverage, 2 of these plans have a $0 copay for a hearing exam, and then there's a variety. There's a whole spectrum of hearing aids you can get, some of them as low as a $100 copay, and then 2 of them don't have it. And that's the thing. Plan 1 versus the new version, if you will. The new version has more dental, but it doesn't have hearing. So it's kind of, you decide which one is more important to you, and you get on that plan. Insulin Senior Savings Program, there's a month supply for $35 or less on all 4 of these plans. Over-the-counter credit, 3 of these plans do have it. Counterintuitively, perhaps the one where you're paying the premium doesn't have this over-the-counter credit. What the over-the-counter credit is it says $164. It's $160 per year. It's really $40 a quarter is what it is. And you can go online by a phone or internet. You can order from a catalog and get a variety of over-the-counter products, not prescriptions. So we're talking about antidigestive or allergy, aspirin, even more medications. You can get some Band-Aids, personal care stuff that you might find in the pharmacy. That's a nice feature. And then a gym membership. Actually, there's a $0 cost gym membership on all 4 of those plans. So having said that, these are specifics. These are the plan numbers and the counties they're offered in Texas. This doesn't matter to me. What's important is we've stepped through these, and I hope you thought about it and understand how plans might vary and have a good idea in your mind as you are ready to take the step, which things you're going to look at to help you decide which one you like. Briefly about United Healthcare, I would remark they have over 40 years serving the Medicare community. More people in the U.S. use United Healthcare for their Medicare provider than any other kind. Members like and keep the United Healthcare's Medicare Advantage plans. I had that number earlier that showed over 9 out of 10 people customer satisfaction. And then they say here, you have our promise and commitment to helping you live a healthier, happier life. My mother-in-law has a plan from these people. They call and check on her. They had a home visit here last week, so they really do care. I just like to give a shout out to United Healthcare in that instance. Okay, these are some additional resources that I or someone else can make available to you. Medicare Made Clear. It's a hard copy of a presentation quite similar in content to this presentation. Medicare Helpline. You can dial 1-800-MEDICARE and talk to a human and ask questions about it. Medicare and You is a nice thick booklet that often CMS, which is a government agency that administers Medicare, sends out to folks as they approach 65. Online plan finders, those plans I was showing you, you can go online and find different plans like that and compare them. State resources, you can go online and apply or at least checkability even for Medicaid eligibility, for example, for financial assistance from the state. SSA.gov from Social Security Administration. You can go online and find out all about Social Security. You can potentially, if you'd like, do both these simultaneously. You can sign up for Medicare and Social Security, and you can say, please pay that $148 Part B premium out of my Social Security if that's something you want to do. You can reach out to Social Security and find out. Administration and Elder Care Locator. And more above and beyond plans, you can find a home health service. You can find all kind of stuff. There's locators online to help you find that. Now, having said that, I can provide personalized support. You can give me a list of doctors, and I can look it up and see if they accept the plans you're considering. You can give me a list of medication, and I can show you how much they will cost at different pharmacies close to you. Access to additional services, I can help you find a gym near you that will give you a no-cost membership on one of these plans. I can help you check your eligibility on Medicare, but that is for Medicaid as well. And if you're a veteran, I can help you find plans that are designed to work with your VA and TRICARE benefits. So having said that, this is me. I've enjoyed visiting with you today. Please consider reaching out to me for further discussion. There's my phone number there, and email is the best way to reach me, tom.basie@gmail.com. And as I remarked before, yo hablo español, así que tenga buen día. Thanks very much. Have a good rest of your day. Thanks for stopping by.